Your Yorkshire Terrier may be tiny, but they live like giants in the dog world. They look fearless, confident, and almost unbreakable. But Yorkies have hidden vulnerabilities that don't always show dramatic symptoms in the beginning. A small cough here, a quick limp there, a day where their spark feels dimmer. Because they're naturally proud little dogs, they hide discomfort extremely well. That's why knowing the major Yorkie health warnings matters. When you understand the early clues, you can act sooner, make smarter decisions, and prevent heartbreak. This is Doggy Pedia. Subscribe if you want deeper insights that protect your dog. 1. Collapsing trachea, the hidden airway problem. A collapsing trachea is one of the most common and most underestimated Yorkie health concerns. The cartilage rings that hold the windpipe open are softer than normal, so the airway gradually narrows over time. At first, it shows up as a dry cough when they get excited or when they pull on the leash. Some Yorkies make a goose honking sound after drinking water, or they pause during play to catch their breath. These small moments are easy to brush off, but they're the early stages of a condition that worsens with pressure, heat, weight gain, or even dust in the air. The biggest danger is how quietly this condition advances. As the airway weakens, your Yorkie may develop noisy breathing, nighttime coughing, or moments when they seem to panic briefly as airflow becomes restricted. Switching to a harness, controlling excitement, avoiding smoke or irritants, and keeping weight stable can dramatically slow progression. The earlier you recognize the signs, the more calmly and safely you can manage this lifelong condition. 2. Luxating patella, the skipping stride. One of the most classic Yorkie issues is a luxating patella, also known as a floating kneecap. It often begins with a tiny skip during a walk, a moment where your Yorkie lifts one back leg, takes a few fast steps, then goes back to normal as if nothing happened. Many owners mistake this as just being playful, but it's actually the kneecap sliding out of place. Over time, this causes cartilage wear, joint inflammation, and pain that comes and goes unpredictably. The risk isn't just the discomfort. Repeated slipping slowly reshapes the joint. A mild limp today can turn into difficulty jumping, hesitation on stairs, or stiffness after naps. Keeping your Yorkie at a healthy weight, avoiding excessive jumping, and building muscle with gentle exercise can help stabilize the knee. With early detection, many Yorkies avoid surgery, but ignoring it often leads straight to long-term joint damage. 3. Liver shunt, the puppyhood red flag. A portosystemic liver shunt is one of the most serious genetic conditions Yorkies face, especially during puppyhood. It prevents the liver from properly filtering toxins, meaning waste stays in the bloodstream instead of being processed. Early signs are subtle but deeply important. Slow growth, episodes of disorientation, pacing, weakness after meals, or moments where they seem spaced out or confused. Some puppies develop vomiting, diarrhea, or trembling that comes and goes without a clear pattern. Because this condition affects detoxification, even food can overwhelm the body. Blood tests and imaging can confirm it, and early treatment makes a massive difference. Many Yorkies with mild shunts can live long, full lives with proper diets and medication, but only if owners recognize the symptoms before permanent damage occurs. When a young Yorkie seems off in ways you can't explain, this is one of the first concerns veterinarians check for. 4. Hypoglycemia, the tiny dog energy crash. Yorkies have tiny reserves of stored sugar, which makes them vulnerable to sudden drops in blood glucose, especially when they are young, stressed, or skipping meals. A hypoglycemia episode can start with shaking, wobbling, or sudden weakness. The dog may become clingy, confused, or unable to stand steadily. In more severe cases, they may collapse, have seizures, or lose consciousness entirely. It's fast, frightening, and extremely dangerous if not treated immediately with quick sugar sources. Preventing hypoglycemia is all about stability, consistent feeding schedules, stress control, and avoiding long gaps between meals. Puppies and very small adults may need multiple small meals throughout the day. Once you've seen a hypoglycemia episode, you never forget it, and you never let your Yorkie go too long without food again. It's one of the simplest conditions to prevent, but one of the quickest to turn serious without warning. 5. Pancreatitis, the hidden consequence of just one treat. Pancreatitis is one of the most painful and dangerous conditions Yorkies face, and it often starts with something innocent: a piece of fatty table food, a greasy treat, or a sudden change in diet. The pancreas becomes inflamed, causing severe abdominal pain and digestive upset. Yorkies are genetically predisposed, which means even harmless foods can trigger a crisis their small bodies can't handle. What makes pancreatitis so dangerous is how quickly it escalates. The earlier it's treated, the better the outcome, and prevention is everything. Stable diets, extremely limited fatty foods, and careful monitoring of treats. Once a Yorkie has pancreatitis, they must stay on strict dietary control to prevent future episodes. 6. Legg-Calvé-Perthes disease, the sudden severe hind leg pain. This condition sounds complicated, but the signs are hard to miss once it progresses. Legg-Calvé-Perthes disease affects the hip joint, causing the head of the femur to deteriorate due to poor blood supply. It typically appears in young Yorkies, often between 4 and 12 months old, and starts with a mild limp that slowly becomes more dramatic. As the bone weakens, the dog begins to lift the leg entirely or avoid putting weight on it, sometimes crying out when touched. What looks like a sore leg is actually a structural collapse inside the hip. The heartbreaking part is how suddenly it worsens. A Yorkie who seemed slightly stiff last month may be struggling to walk this month, and ignoring it only increases the pain. With early diagnosis and treatment, which may include surgery, most Yorkies recover extremely well, often returning to normal activity levels. But catching it late means months of discomfort and long-term mobility issues. If a young Yorkie limps without clear cause, this condition should immediately be on the radar. 7. Chronic allergies, the never-ending itch cycle. Yorkies are notorious allergy dogs. Their skin, stomach, and respiratory systems react intensely to environmental triggers like pollen, dust, grass, and even indoor cleaning products. Food allergies are just as common, especially reactions to chicken, beef, grains, and artificial additives. The signs can be subtle at first: paw licking, ear scratching, red skin, or constant chewing at the tail and legs. But when allergies flare, the discomfort can take over their entire day. They become restless, irritable, and unable to settle because their skin never stops itching. The biggest danger isn't the allergy itself, it's what comes next. Constant scratching breaks the skin barrier, allowing bacteria and yeast to cause painful infections that require medication to control. For some Yorkies, allergies are chronic and require long-term management, including diet changes, vet-approved skin treatments, and avoiding triggers. With consistency, allergic Yorkies can live very comfortable lives, but ignoring the early signs creates a cycle of flare-ups that becomes harder and harder to break. 8. Dental disease, small mouth, big problems. Yorkies have extremely crowded teeth for their size, and that makes dental disease almost inevitable without active care. Plaque and tartar build up faster in small mouths, leading to gum inflammation, tooth loosening, and even bone loss in the jaw. What starts as bad breath can eventually turn into difficulty eating, bleeding gums, or teeth falling out entirely. Owners often underestimate how quickly dental issues progress in toy breeds, but for Yorkies, ignoring oral care is one of the fastest ways to shorten their lifespan. Dental disease doesn't stay in the mouth. Bacteria enter the bloodstream and strain the heart, kidneys, and liver over time. Good dental health is more than brushing. It's monitoring eating behavior, watching for chewing changes, choosing the right food texture, and scheduling professional cleanings before problems escalate. A Yorkie with a clean mouth lives longer, breathes easier, and avoids one of the breed's most preventable health threats. 9. Heart valve disease, the quiet aging danger. As Yorkies get older, one of the most significant health concerns they face is heart valve disease, especially degeneration of the mitral valve. This condition starts silently, often without symptoms for years, as the valve becomes less efficient at keeping blood flowing properly. Eventually, small signs begin to appear: a soft cough at night, fatigue after short walks, or a slower recovery from excitement. These changes usually slip by unnoticed because owners assume they're just normal aging. But in a Yorkie, they're often the early signs of a heart working harder than it should. Left unmanaged, this can progress into fluid buildup around the lungs or heart enlargement, which rapidly affects breathing and stamina. The good news? When caught early through routine checkups, medication can keep the heart stable for years. Regular senior exams, weight control, and monitoring subtle breathing changes help Yorkies live longer, more comfortable lives. Heart disease doesn't have to be a crisis, not if you watch for the signs while they're still small. 10. Anesthesia sensitivity, a toy breed medical risk. Anesthesia sensitivity is a lesser-known but extremely important Yorkie health concern. Because of their small size, fast metabolism, and low body fat ratio, Yorkies process sedation drugs differently than larger breeds. A dose that's safe for a medium-sized dog can overwhelm a Yorkie if not precisely calculated. This becomes especially relevant during dental cleanings, spay or neuter procedures, or any surgery requiring sedation. Some Yorkies experience slow recovery, vomiting, unstable temperature, or unusual lethargy afterward, signs that the anesthesia affected them more intensely than expected. The key is preparation. Not all veterinarians use toy breed-specific anesthesia protocols, so it's essential for owners to ask. Pre-anesthetic blood work, tailored dosage, careful monitoring, and a heated recovery environment make a massive difference. Many complications are preventable with the right precautions. Yorkies can undergo procedures safely. They just require a level of precision that not every vet automatically provides unless asked. Yorkshire Terriers may be tiny, but their bodies speak in whispers. A softer spark, a quiet cough, signs easy to miss unless you know what to look for. Now you understand those messages. You know which changes are harmless and which ones deserve attention. With early awareness, your Yorkie can stay brighter, stronger, and more comfortable for years longer than most owners realize. They trust and rely on you completely. And if you want deeper guides that help you protect them even better, subscribe to Doggy Pedia. We're here to keep your little one healthy for life.